Okay, everybody, we're going to go ahead and get started. Okay, so good afternoon. Today is Tuesday, May the 21st. This is the Public Health and Safety Committee. We do have a quorum with myself, council members Ben, Bradford, Gregg, Harrell, Nash, Prepti, Sepulveda, and Weiner. And so if anyone else joins or leaves, I'll update that accordingly. We did have a cancellation on our presentation today. Dr. Cynthia Kroom from Metro Action Commission had a death in her family. So we send her our condolences to her and her family on that passing. And so I'll be working with her office to be able to reschedule her at some point in the future. With that, we do not have anyone signed up for public comment today, so we're going to go ahead and get right into the agenda, and then I will take some department updates. So if you take a look at page 2 of your agenda, these are the items that I have on consent. Item number 4, RS 2024-457. On page 3 of your agenda, I have item number 5, RS 2024-458. I also have on bills on second reading, item number 7, BL 2024-347. Does anyone have a need to pull any of those items off of consent? Council member Prepti, let me find you. Here we go. You're recognized.
Thank you, Madam Chair. I just have a singular question for agenda item number 4, RS 2024-457.
Okay, so I'll go ahead and pull it off consent. That way we can get any other questions answered. So thanks for letting me know. Anyone else? Then we'll move on to our short and limited consent agenda here. So first item on consent is RS 2024-458 by Porterfield, Evans, and Welsh, approves Amendment 1 to a grant from the Tennessee Department of Children's Services to the Office of Family Safety to support the provision of services to families who have experienced domestic violence and child abuse and neglect. Item number 7, BL 2024-347 by Coupin, an ordinance to provide for the designation of public property within specified areas of downtown Nashville as a temporary special event zone during the time period beginning at 9:00 p.m. on July 2nd, 2024, and ending at 11:59 p.m. on July 5th, 2024, relative to the use of these areas in conjunction with the 2024 July 4th celebration and related activities and events. Do I have a motion? Okay, it's been moved, and do I have a second? All right, thank you. It's been moved and seconded. All those in favor? Anyone opposed? All right, so we recommend approval on those items. So we'll go back. Oh, thank you. We have 10 now. So it's 10, 0 against, and 0 not voting. All right, so we'll go back to page 2. Item number 2, RS 2024-351 by Coupin, Horton, and others. A resolution requesting certain departments of the Metropolitan government to provide a comprehensive analysis of recommended changes to increase the safety, security, housing, resources for the unhoused, and cleanliness of the properties surrounding the Cumberland River within the downtown interstate loop. Do I have a motion? Okay, it's been moved and properly seconded. We'll open it up for discussion. I'll recognize the sponsor, Councilmember Coupin. Councilmember, you're recognized.
Thank you for recognizing me, even though I'm not on this committee. This is the river resolution that I had previously. Worked with the administration and multiple departments on an amendment that cleans up some of the language, also brings planning into the fold, who have graciously offered to help bring this all together into a final report. For recommendations for short and long-term efforts along the riverfront, including resources for the unhoused, cleanliness, safety, etc.
All right. Do we have any discussion from anyone on the floor? Seeing no discussion, any other comments that you'd like to add, Councilmember Coupin?
That's all. If someone would be so kind as to move my amendment, that would be lovely.
All right, so we have the amendment added to the resolution. Any additional comments related to the context of the entire resolution?
Nope, those are good, thanks.
Very good. Okay, any additional discussion? Seeing none, all those in favor? Anyone opposed? Okay, we've got recommend approval, 10 in favor, 0 against, 0 not voting. Now we're up to 11. Okay, let's go to item number 3. Oh, yeah, well, let's do that. Should we do that? Let's vote on the resolution as amended. All right, all those in favor of the resolution as amended? All right, anyone opposed? Anyone not voting? Okay, great, thank you. Let's go to item number 3, RS 2024-397, Porterfield, Evans, and Taylor accepts the terms of a cooperative purchasing master agreement for the executive search and direct permanent placement services for the Metropolitan Action Commission. Do we have a motion? All right, it's been moved and properly seconded. There was a discussion about this item in budget, and I would love to recognize if there's anybody here from Metro Action. I'm not sure if there is. Oh, yes, I see you. Please come down and I will turn on the microphone for you.
Good afternoon. Benita Davis, Director of Administrative Services and Operations for the Metropolitan Action Commission. The question from Budget and Finance had to do with the budget for the search, and those funds are coming from the Kresge Foundation. We are asking permission to engage, for you to accept this contract so we can begin an engagement with the search firm. We cannot do that until we get your full approval.
Thank you. And could you remind the committee while you're here, like what's the timeline for the search? I think maybe we had heard previously that it was September was when Dr. Kern was officially retiring.
She is currently eligible for retirement. She has a tentative date of the end of September. That is correct.
Okay, very good. How about any discussion on this item? All right, seeing none, I really appreciate you being here to answer that question. Can anyone renew the motion to approve? Thank you. It's been moved and seconded. All those in favor? Thank you. Councilmember Bradford, were you raising your hand to speak? Okay, let me recognize you. I'm sorry, I did not see your hand. Hang on just a second. All right, you're recognized.
This is just a general question as to why we are contracting with third parties to do these searches instead of going through HR. If anyone can answer that.
I don't know who wants to take that, if that's an admin question. Oh, looks like Councilmember Gregg may have some insight. Okay, we'll go with it. Let's see what you say.
I think it's one of 2 approved outside sources for search that we've been authorized to use. And they looked at the 2, chose this firm. I think that's correct.
All right. Does anybody? Okay.
I'm on that board.
I know you are. Trust but verify. What
Yeah.
can I tell you? But thank you for your input. So, Councilmember Bradford, does that answer your question?
No, but I would like for Mr. Rosenberg to weigh in and confirm.
I would defer to Mac on this one.
All right, thank you, Mr. Rosenberg. Okay, let's move on then to RS 2024-457 by Porterfield and Evans, accepts a Homeland Security grant from the Tennessee Emergency Management Agency to the Office of Emergency Management to implement state Homeland Security strategies by addressing the identified planning, equipment, training, and exercise needs required to prevent, respond to, and recover from acts of terrorism. Do I have a motion? All right, it's been moved and properly seconded. Do we have some discussion? Councilmember Prepty, hang on. All right, Councilmember Prepty, you're recognized.
Thank you, Madam Chair. Just a quick question, Captain Young. I was looking over this contract last night, and then it had a specific line item for, I believe, and I'm not able to pull it up right now. My computer's not working, but I believe it was essentially for professional development and fees and things like that. I was just wondering if you could talk to us about the specific like training program or sort of what all is entailed within the like professional development under this contract.
Yeah, sure. This is very similar. I think this is actually the same grant that was before council. I'm thinking back in January where we had a lot of discussion around this grant. To answer your question, so the training that's involved in this would be the training that's done with the atmospheric monitoring, the new technology that comes with that, the upgrades that come with that equipment, the handheld devices of the air monitoring system. This training is held at the Special Operations Building over across the river, and it's training on atmospheric monitoring.
Thank you, Captain Young. And then a follow-up question for the chair and potentially Director Darby. Under this and potentially for you as well, Captain Young, under this contract, it specifically discussed how Tennessee is divided into 11 Homeland Security districts across the state, and there are generally assessments done with these grants for allocations of resources based off the specific need. I was just wondering if at any point, whenever OEM or our emergency services are contemplating applying for subsequent grants, if this committee could have an executive session where we are briefed on sort of like what that assessment has detailed for, or sort of just what the threat assessment is for Nashville, Davidson County, and for the surrounding area.
With regard to having an executive session, typically those are closed to the public, and I do not think that that would be appropriate. We would have to look at I would have to look at the specific circumstances, but absent it being something specific to ongoing litigation or potentially threatened litigation, my answer would be no.
Okay, then I'll just follow up and say, Captain Young, I might be following up with you to just have a one-on-one conversation and see if I could personally be briefed on that assessment. But.
Yeah, and Councilman, I'd be glad to bring you to our operations and let you really get a deep feel.
Thank you, Madam Chair.
Thank you, Councilmember Prepty. Any other discussion on this item? Okay, do I have a motion? All right, it's been moved and seconded. All those in favor? Anyone opposed? Anyone not voting? I know, I'm not going to count you because you just walked in. Yeah. So thank you. We recommend approval. 11 in favor, 0 against. Okay, so now we will go to item number 6, which is RS 2024-459, Porterfield, Evans, Welsh, and Allen appropriates a total of $500,000 from the Metropolitan Government acting by and through the Office of Homeless Services to DePaul, USA for the provision of startup property management, on-site support, and case management services at the Strobel Permanent Supportive Housing Residence. Do I have a motion? All right, it's been moved and properly seconded. Any discussion? We've got Council Member Huffman, so I will recognize you.
Thank you, Chair. Bill's ready for me already. Thank you, sir. Just a couple of quick questions that I want to revisit that I asked last night in budget, but I think it's very relevant for this committee. Number one, can you talk to the long-term plans for the Strobel Center? This is only a 4-month contract, so if you could just speak to that.
Yes. I didn't know if she was going to recognize me or not, so I was waiting.
Oh, I apologize.
I'm sorry.
Mr. Clendenning, you're recognized.
Thank you. It's a great question, of course. Yes, this is a short-term startup funding for 4 months. But there is also, right now we're in the competitive process vetting 2 different revenue sources for sustainable long-term, long-term income. And then as well as Mary Jo Wiggins commented last night, we were before the ARPA Oversight Committee, and they allocated $4.4 million for the first year operating for this facility.
Okay, thank you.
Sure.
Next question pertains to the management of the chronically homeless population. Correct me if I'm wrong once again, but I believe that the Strobel Center is going to be at 50% dedicated to the chronically homeless.
That is correct, yes.
Could you speak to DePaul's experience with managing the chronically homeless and any successes that they've had in other cities?
Yes, I'd be glad to. Actually, I have more information than I did last night. But they are currently operating 23 similar programs in 10 different cities.
Thank you. And one last question around the wraparound services that would, I assume, be included within the management. Yeah. Could you speak to that just a little bit? And by wraparound, just for everybody listening at home, mental health services, substance abuse services.
Yes, that's part of DePaul's, will be part of DePaul's contract. You know, the property management piece and then the supportive services, working with service providers here to make sure that piece is in place. That's, you know, as we all know, that you can't expect someone to succeed if they don't have those services, so.
And lastly, when are we anticipating this will come online?
I believe it's a June 7th opening date.
Thank you.
You're welcome.
Thank you. I have a question actually based on your comment about the 23 similar programs. Do you know, are they operating in similar ways that Nashville is using them from a startup perspective? Or do they also do like some of the longer term where they are the provider and managing those?
I don't know
Sites.
that, actually.
Oh, it looks like Director Calvin, she's hopping up, so it looks like she's got some additional context. I'll recognize Director April Calvin.
Hello, Director Calvin from the Office of Homeless Services. One other question, I want to go back a little bit. For when the units come on, we're thinking late June. We're going to have a grand opening, so there will be information that will be sent to you all once we get a final date on that. We're working on the final pieces like furnishing and nameplates and things like that for the building. Also, what was your question one more time? Sorry.
Oh, me?
Can you, yes.
Oh, yes. My question was on the Mr. Clendening's reference to the 23 similar programs. If they're being implemented similarly to Nashville, or if they're also potentially the long-term provider at these other sites.
They are the long-term provider, and they will be the long-term provider of this site. We're doing startup costs because we were waiting for ARPA funds to come online and make sure to have a great marriage there. So that's the only reason that we have the startup cost. But DePaul is used to going to other cities and starting units like this. And as Mr. Clendening said, they have 23 other locations in 10 different cities. And so they've already had boots on the ground here. They're making relationships and partnerships here, and they will provide the supportive services and the property management, along with partnering with other supportive service opportunities in Nashville.
Okay, and you kind of triggered another question. So based on the that process, and I don't think I was clear yesterday in budget that this was intending to be kind of the longer term provider. I just thought we had the gap kind of related to money. But have the folks that will qualify to be in the permanent supportive housing, have they already been identified, or is it something that you all will be identifying closer to the opening date?
We have a robust by name list. So I won't say that they've been identified for who's going in the units, but we will utilize the coordinated entry by name list to fill those units.
All right, thank you. It looks like Councilmember Huffman, you're recognized for another question.
Thank you very much. Just one last question for you, Director Calvin. Do we have a goal in regards to the two populations, chronic and non-chronic, in regards to how long we anticipate them to reside at the Strobel Center?
So this is permanent supportive housing, and the main goal is long-term placement. I think the federal government likes 3 to 5 years for long-term placement. And as we provide, or as DePaul provides permanent supportive services there, the only way someone should leave should be, with moving out into other permanent housing options. If there's a need for more intensive services, this is a lease, so it's actually permanent housing, not like transitional housing or temporary stay.
Thank you. Just one more question,
Sure,
then
go
I'll be
ahead.
done.
Okay.
Thank you. What about reentry into the workforce? Is there going to be any focus with this population living here?
So we have an emergency service manager that we're looking to utilize to help with job fairs and connecting with, even if it's labor ready and some of the temporary options that are available, definitely looking to partner with Goodwill and deploy some of those services there as well. But we would want them to have a, wonderful opportunity into advancing their life.
Thank you.
All right, thank you, Councilmember Huffman. Let me get Councilmember Bradford. You're recognized.
Thank you, Chair. Following up on a previous question from Councilmember Huffman, in regards to employment, have you thought about looking or working with Metro HR to see if some of these individuals can be placed in some of the jobs we're needing help with around Metro?
Absolutely. We worked with Metro HR almost 8 months ago on opportunities for our encampment support and that ways that they could help with frontline. We can help with fill frontline positions. And so our emergency service manager will bring them to the table when we have job fairs as well.
Awesome. Thank you.
All right, thank you. Let me recognize Councilmember Weiner.
Thank you, Chair. I appreciate it. So when we talk about permanent supportive housing and wraparound services, talk to me about the criteria in which these folks will be admitted to the facility. In other words, and I think to an issue that we've had several times in the Bellevue area, where our quality of life officer has made connections and we have been able, through the good graces of some local residents who have made connection with Salvation Army or whoever, in order to get these two people that I'm thinking of right now into the facility to get the wraparound services and to get housing. And one of them is a female veteran who, the story is just awful and she's just screaming for care. And so, or, support and being uplifted. So my question is, because of her drug use and because of those issues that she has and refuses to give it up, that is why she could not get into any of the housing options that we were affording her. How is this going to work differently?
So as a housing first community, no one should deny her access unless it's a unless it's a abstinence-based program. So like the Salvation Army and other places, you don't have to be clean and sober in order to get housing. And I would work with you after this meeting to clarify some of that.
That would be great.
The main criteria for this location is you have to be homeless and already on our coordinated entry list. So we're going to utilize that list to help with moving people into the PSH units.
Thank you.
Thank you.
I'll come back there in a minute.
All right, any other discussion on this item? Okay, seeing none, thank you very much, Director Calvin and Mr. Clendenning. Seeing none, we'll go ahead and move forward with voting. All those in favor? Anyone opposed? Anyone abstaining? All right, so you recommend approval? 12 in favor, 0 against, 0 not voting. Okay, we're going to move into department updates, and I'm going to invite Captain Cantrell and Sergeant Hotz to come forward and talk about the press release that MNPD issued earlier today.
Hello, I'm Captain Cantrell with Metro Nashville Police, and I'm actually going to introduce Sergeant Hotz in order to speak more in depth on that press release.
Thank you.
Good afternoon, council members. Thank you very much for bringing attention to this very important matter. This past Sunday and Monday, we had a significant increase in overdose activity in Nashville, Davidson County. It was the largest that I've noticed in my tenure over the county during that 2-day period. There were 29 overdose incidents within our city. That's a significant number. Which triggered alerts from our automated systems, letting us know that there was an issue. In one instance alone, this was underneath the pedestrian bridge. There is kind of a little hangout area on 4th Avenue South in between Demumbrian and Broad Street. In this one single incident, it was about 1 a.m. on technically Monday morning, late Sunday evening. 8 individuals overdosed in the same area at the same time. 2 individuals died of their overdoses, but 6, fortunately, were able to be revived through the use of Narcan and a quick response through the Entertainment District Unit as well as the Nashville Fire Department. That's 8 overdose incidents out of the 29. There were also some incidents on Harding Pike near I-24, as well as in the Murfreesboro Road corridor. We brought this matter to the attention of all of the partners in care that we work with in the overdose community, to include the director and many other people. What it turned out to be is this overdose outbreak, particularly on 4th Avenue South by the pedestrian bridge, disproportionately affected the unhoused community. And it appeared that they believed they were purchasing crack cocaine, when in fact it was a mixture of crack cocaine with a high concentration of fentanyl. And unfortunately, we can expect that this is due to a batch of illicit narcotics that were unfortunately mixed with potentially fatal doses of fentanyl. Myself and the regional overdose prevention specialists mobilized as soon as we could. We went down to 4th Avenue South on foot. We went to areas that are commonly frequented by unhoused individuals, and we spoke with a lot of that community and warned them of the particular contamination of fentanyl within the crack cocaine supply. And we also provided approximately 80 doses of Narcan to that population, as well as information on how to reverse an overdose. As an aside from that, I wanted to inform the council, and I know Councilmember Evans is knowledgeable in this field too, but we've also had recent great success on Broadway at the different music venues. They have requested overdose reversal units called one boxes, and I've personally installed 21 of them in about 16 different venues on Broadway, and I was just resupplied with more one boxes today, and starting tomorrow and on as long as necessary, we're going to be installing them in as many venues as possible.
I thank you very much for that update. I could you explain to everybody, just because I'm not sure that everybody in the room knows, who the regional overdose specialists are and kind of where they come from and that kind of thing?
The regional overdose prevention specialists are a subsection of the STARS program, if anybody's heard of that. What they do is integral to our mission in ending overdoses in our city as well as across the country. They provide education on what an overdose looks like. As a requirement to be employed as a regional overdose prevention specialist, they need to be an individual in recovery with lived experience. And they have free naloxone or Narcan or Cloxato products of the overdose reversal medication. And when they provide the training to individuals, they can also give them for free a supply of Narcan so that hopefully somebody could save a life. We also have a partnership and a memorandum of understanding with ROPES. We call it the Leave Behind program, where ROPES provides myself as well as 2 years ago, we hired an overdose prevention specialist who's a retired nurse that works with me day in, day out. And if we are out in the field and we're in the presence of someone who is in immediate danger of overdose, or if their close family friend or her family member is at risk of overdose, we're able to leave behind some Narcan as well as literature on treatment resources as well as overdose reversal.
And thank you very much for that explanation. And then as far as the installation is concerned, the music venues, that was all voluntary on their part. And you worked with Mr. McDonough at the Office of Nightlife and kind of worked with those connections that had been built kind of over time related to the sexual assaults. And I'm providing a lot of context here, but sexual assault center, safe bar program, and then of course the beer board and all of that. And so it's all private businesses that have taken on you coming and doing these installations, right?
Yes, ma'am. It's all been voluntary. This has been a project of mine trying to seek buy-in from our community members and businesses for the installation of these boxes. And I believe it's recognition that this overdose crisis is a significant issue facing our community. And Mr. McDonough has been instrumental. I've been trying for 3.5 years to have these installed, and it was limited success up until about 2 weeks ago. And all of a sudden, it was a title change, and everybody was requesting it. And since I've been working on it for so long, I was happy just to drive down there myself and install them myself.
Well, thank you for doing that. And I know I saw Councilmember Porterfield raise her hand for a question. So Councilmember Porterfield, I'll recognize you.
Thank you so very much, Chair, and thank you so much for your work on this. It's very important work, and I've been very thankless. Can you clarify what department do you work under directly?
I'm a sergeant with the Metro Nashville Police Department. I work in the Specialized Investigations Division, and I am one of the 2 supervisors of the overdose unit. All we do is overdoses. We have one section that investigates fatal overdoses, and then my section, which involves community outreach, overdose prevention, and long-term strategies to help end this epidemic.
Thank you so much. And my question is stemming from, I guess, just trying to get an understanding why this isn't under the health department. And again, thank you, because this needs to be done. It is so important. And I thank you for your commitment to this. I'm just trying to get an understanding as to why our health department is not leading on this. Do you partner with the health department? And do we have anybody here from the health department that can answer that question?
I cannot speak for the health department themselves. They're a separate entity. I can only speak for what my team and I do. In reference to your specific question, we do partner with the health department as much as possible. And I would be happy to meet with you offline about the extent of that. I don't want to bore all the council members with that. That being said, I'll work with anybody who will listen. We have more partners in care that I can mention.
Thank you. I appreciate it.
Thank you. And it looks like Dr. Wright is here, and so I'll let him recognize Dr. Wright from the health department.
Thank you, Chair.
Thank you. You know, they're out on the street on a daily basis, and so we partner with a number of organizations and try and get Narcan and other things out wherever we can. Obviously, with police being out and in those areas, we're happy that they're doing that and partner with them. Also partner with Streetworks and others with Needle Exchange and also providing them. But we haven't had until recently much of a supply of Narcan. We've just recently been given supply from the state. So we're looking at all opportunities, and we are working on, we just had a training episode about 2 weeks ago, and I think trained about 30 people in the use of Narcan, and obviously as part of that training, then they also took Narcan home with them. So.
Thank you. Is Narcan available for purchase?
Yes.
Okay. Is there a reason?
It's also free at any of our health clinics. We now have it available so.
I appreciate that. I'm just trying to understand why the health department hasn't purchased Narcan if they were waiting on the state. Just trying, it doesn't feel like the health department is leading on this. So I'm just trying to get a good understanding. And we can have this conversation offline as well, but I would like to publicly state that I do believe that the health department, and again, thank you, because this is not a slight towards MNPD whatsoever, and I appreciate what y'all are doing, but this feels like this needs to be led by the health department and partnered with other individuals and other entities, but I will gladly speak with you offline about it.
Yeah.
I guess I think the only follow-up question, Dr. Wright, I have is I went to a session recently with where there were some library employees attending, kind of talking about their budget interests. And I talked with one library employee that spoke specifically to the voluntary nature of, like, because there's so many folks coming to the library, you know, they've had kind of overdose incidents occur in the library. And so employees voluntarily getting themselves trained, and then also having access to Narcan, you know, just in that case. And I know 2 years ago, I had started to go down the path kind of towards the end of my chairmanship of, like, how could we have Narcan in metro buildings? And so I think that would be a great thing to look at exploring again, especially since we have, you know, in this instance, the downtown bars are leading on this response. And I don't know how we can model that behavior better. And I'd like to look at that maybe with you and the chair of budget also.
We'd be glad to talk about that. I know that we have been looking at pricing out dispensing machines where we can just put them wherever is needed. So
Yeah, because I know the behavioral care center has one, you know, in the jail. And so I think it's worth looking at because I want to be the leader. I don't want to be the follower. And so, you know, I want to look for opportunities that we can lead on this. And I see a couple other hands raised. So let me recognize Council Member Huffman. Hang on. There you go.
Thank you, Chair. Thank you, Dr. Wright, for being here today. Quick question for you. I'm not going to hold you to the exact number. How many fentanyl overdoses have we seen in the last calendar year?
fentanyl is one of many drugs that we typically see within overdoses, and it comprises someplace between 70 and 75%. It's in 70 to 75% of all overdoses. Year to date, we are down year over year. So in the first 18 weeks of this month or this year versus a year ago, we're down about 20% in non-fatal and fatal. However, last year numbers were over 700 deaths. So being down 20% is nice, but it's not an answer at all.
And just for clarification, and I may have heard you wrong, so just making sure, but when you first got up here, you had indicated that we didn't have a lot of fentanyl activity with overdoses. Is that what, just to set the record straight?
Right. So it's not that we don't have, it's we haven't had any budgeted amount that we could use on those. The state has given us money and Narcan recently, so we are using that. And then, you know, from the overdose standpoint, the other thing that we need to be doing, and we've got coming before this council in the near future, will be a pilot program for treatment to try and stop or to try and address overdose on an ongoing basis. And that'll basically a pilot to look at a year-long treatment and all the costs associated with it.
Is there any educational opportunities or even any educational training going on right now in the unhoused community to warn them of potential, I don't know if you call it dirty drugs or laced drugs, I would say?
Yes, and there are a number of different partners, including police, including some of the Vanderbilt physicians that are out actually in the sites and within the different housing areas. Most of the time, they're going to use because they're going to use, but trying to get established a way of when they're ready to go into treatment, immediately get them into treatment. That is the biggest thing right now, is that people that do not have any insurance is closer to months rather than weeks to get them into treatment. So,
yeah. Chair, do you think we could have Dr. Wright back within a reasonable amount of time to hear how that trial period is going?
Well, we haven't approved it yet,
Okay.
and so it'll be a while before they actually have any data around it, since they haven't even gotten started. So, Dr. Wright, if you have any.
Chair, we'd be glad to come back and talk about the overall intent of that and the rest of the questions that have been asked tonight, and to bring my behavioral health specialist with us.
Okay, that sounds good. Thank you very much. And Councilmember Webb, did you have your hand raised? Did you want to ask a question? Let me recognize you if I can find the button for you. There we go.
Thank you for recognizing me. I was just wondering, where are the boxes budgeted from that he's speaking of?
They're actually not a budgeted item. They're paid for by a nonprofit. There is the charitable arm of Gibson Guitars is called Gibson Gives, as well as Tempo. And it is a program that was started to address the disproportionate effect of the overdose crisis on the musicians within our community. And Gibson Guitars funded it through them. They have an agreement with Hikma, who is the manufacturer of Cloxato, which is an overdose reversal drug. It's a double dose of what more commonly known Narcan. So they HICMA provides the overdose reversal medication, and then the box itself, I'd be happy to demonstrate it to anybody who would like to see it. It looks like a first aid kit, smaller than an automatic external defibrillator, and it opens, the top of it folds down. There is, on the inside, there is a CPR kit that includes a mask for rescue breathing protection, as well as rubber gloves. And there's also the 2 doses of the 8 milligram Cloxato. But the best part of it is that there's a screen that folds down, a small LED screen that plays a short video on what an individual needs to do to reverse an overdose. They essentially cost $200, but Gibson Gives is able to purchase them at a small discount, and they're provided free of charge to me, where I can then have them installed in these music venues or elsewhere.
Councilmember Webb, did you have any other questions about that? I have one question. I'll then come to Councilmember Porterfield. On those boxes, and I would love to see a demo because I've never seen one, but on those, when they're used, so then what happens? Are you able to refill the box with, replacement Cloxato, or do you have to get a whole new box?
You can just replace the Cloxato on the inside. There's 2 separate doses there. And a common question I get from the venue owners is like, what happens if, let's say, somebody comes and steals the Cloxato out of the box? And my response is that that's fine, because it produces no narcotic effect. It doesn't get somebody high. There's virtually no side effects at all. The only thing it does is it removes the opioids from the opioid receptors in the brain. There's no negative effect to it. I could sit here and do 5 doses as I'm speaking to you. You wouldn't see any difference in my appearance or my speech or anything. And so to address your question directly, if doses need to be replaced, Gibson Gives has an agreement with HICMA where they get the Cloxato provided to them free of charge. And then also I have many partners within the overdose community where I've also offered our services. I have a very large supply of Narcan and Cloxato at my disposal.
And so in those bars, then, are they, the security officer, are they the ones that are going and informally kind of looking to see if it's been used? Can you tell from the outside if it's been used, if it's open, has it been used?
There is a little plastic security tag on it, so you can tell if it's been tampered with. But if you need to open the box, you just kind of give it a little pull and that security tag breaks. That's up to the bars whether or not they use that security tag. Sometimes they want easier access and don't want somebody to have to break the tab. It doesn't matter. And that little video screen has a small battery, but the screen itself only needs to be charged about twice a year.
Okay, thank you for that information. So Councilmember Porterfield, I'll recognize you.
Thank you, Madam Chair. I would love to piggyback on that when you get to have your when you get to go do a tour of it or see it, I would love to be able to go as well. If you had your ability about how many more of these, obviously we would love to have them everywhere, right? But if you just had to say, hey, it would be really helpful if I had 100 more of these or 1,000 more of these, how many more kits do you need to kind of be a little more effective?
I just had a delivery from Gibson Gives of 24 one-dose boxes. They didn't have the overdose reversal medication, the Cloxato, to go in it, but as I mentioned before, I have that at my disposal, so I am able to fill the boxes myself this time around. I don't have an exact number for you. I do know that we've ran through, because of this push that I'm very grateful for, to have these boxes installed at the venues. We have pretty much depleted Gibson Gives' supply of these one boxes, and they are in the process of reordering, I believe, 30 more, if I'm not mistaken. I think if I was able to have 100 at my disposal, that would at least be a very good start.
Okay, thank you. Let's chat offline.
Yes, ma'am.
Any other questions from the committee? Okay, first of all, I really appreciate the comments and feedback and everything. And Director, I don't know, did we really address the question around communication? I know you talked about being kind of out in the field and partners and that kind of thing, but Director Calvin, did you have anything to add related to communication to other organizations that are touching the folks experiencing homelessness?
Thanks for having me back again. I want to say I think we're partnering with some of the same people. I call them stars. He calls them ropes, right? So we have some of the same partners in mind. Also, what we're looking to bring is recovery opportunities. We're partnering with like Hustle Recovery or Meharry. How can we deploy some recovery opportunities to that space? Sometimes when there's something as significant as this, then that sometimes help drive movement into recovery options.
Okay, thank you so much, Director Calvin. And then I guess one other question I had probably for Sergeant Hotz, because Councilmember Porterfield had asked about, the cost or being able to buy it, in Walgreens or whatever. And what's the retail cost currently? Do you know?
I believe it ranges from $40 to $60. I know my opinion is irrelevant at this point, but in my personal opinion, that is cost prohibitive to somebody who is suffering from opioid use disorder or substance use disorder. They're not going to prioritize spending $60 on the overdose reversal medication, which I believe it's so important with what my team does, as well as all of our partners in care, getting free Narcan or naloxone or Cloxato into the hands of those that need it free of charge with no questions asked,
Yes.
as well as providing treatment resources for people to receive treatment when they're ready.
Yeah, thank you very much for that information. Any other committee questions? Thank you, Sergeant Hotz, for being here and I see Councilmember Weiner. Hang on just a second, Councilmember. You're recognized.
Thank you, Chair. While we have you here, can you share with us what you see as the gaps to longer-term success?
Treatment resources, and treatment resources. Recently, I have had some cause for hope, which I've been supervising this unit since its inception. There haven't been many cases for hope. It's been a lot of death. But we had a very small reduction in overdose deaths in 2023 compared to 2022. It's statistically insignificant, but I'm going to take it as a sign of hope. And I also get some hope from the recent opioid settlement funds, where there's going to be what's called mobile MAT, which is medication-assisted treatment. That's the medications that help somebody suffering from opioid use disorder. It's a start of treatment to get somebody to a clean and sober life. And they're partnering with Samaritan House. I don't know if any of y'all, they recently had a grand opening of their beautiful new facility. So through Mobile Crisis, they're going to provide the mobile medication-assisted treatment, and then Samaritan House is going to provide the long-term care and the wraparound resources that are so essential to people's success in beating this disease. And I choose to be a little bit hopeful.
Who would be taking the lead on coordinating treatment resources and implementation and distribution?
I suppose the health department. I have a meeting scheduled. It's going to be on Thursday. I just previously mentioned Mobile Crisis doing the MAT treatments. Another program that I've been working on for almost 4 years is a co-response model. If you're familiar with the Metro Police Department's Partners in Care, where we have a licensed social worker in the police car with a uniformed police officer, this would be the overdose version of that, where if the police department is out on a call, we're able to respond to a call, and let's say it's a non-fatal overdose, when it's possible that somebody could be ready to receive treatment, we would be able to be there with the licensed clinical social workers who would have prescription power, where they would be able to prescribe MAT to the individual right there. And I'd be happy to speak on this at any other time, but the statistics of survivability, if somebody who is suffering from opioid use disorder just gets that first dose of Suboxone or Subutex, their chances of survival at the 1 year mark after that is 80% greater. So that's a significant statistical gap that I feel I'm hopeful in the very near future we're going to be able to provide those services to our citizens.
Thank you so much. Chair, I would like to ask that we do a little research on how we facilitate a working group, if you will, of departments that could help drive the coordination of the securing whatever treatment protocols, whether it's Narcan or whatever, as well as implementing the distribution and more of an engagement of all of those parties so that we get a more dynamic response to this.
Thank you, Councilmember Weiner. I have noted that, and I will definitely talk with you offline, and we can socialize that idea. So thank you for asking about it. Any other discussion or questions for any of our stakeholders while they're here? Oh, yes, I'm sorry, Councilmember Benton, I almost forgot you. You're recognized.
This is an area of expertise that I'm involved in, or have been actually over the last 30 years, and specifically in the last, couple of decades. This thing's grown out of nowhere into just a monster and taken over the world. And now that this stuff is so available, it's even worse. And it's fairly inexpensive, but you hit on it. Treatment availability. We have to treat. If we don't treat them, they're not going to change. It's going to take significant treatment. And Dr. Bright also said the same thing. Significant treatment, which is going to be lengthy and long-term. This does not fix itself. We can get someone off and unhooked in probably 2 weeks. They won't stay that way. And that's kind of the quick fix, the Band-Aid. We're going to bring them in and clean them up, polish them up, and send them back out. Good as new. No. That's a viable treatment, really. False hope for sure. But they need to be able to be in a treatment facility or closely watched and monitored for probably a year minimum, 9 months, a year. And, you're still only hitting probably 80%. And a lot of this stuff goes on and on for years. And then you got to taper down off their Suboxone or whatever method we use to manage, which is a substitute, but it also has something to curb the buzz. So it's a complicated thing, but it's simple, but to put it all together is a little tricky. And it requires enormous resources, actually, to get them in-house for that first part. And then to gently and slowly release them back on their own so they can maintain on their own. Got to get new friends, new hangouts. And but, yes, you have hit on it, and so did Dr. Wright. Thank you.
Thank you,
for
sir.
what you're doing. You're without the boots on the ground, we can't save them in the beginning. So you guys are that first step.
Thank you, sir. I'm passionate about it. My personal life experience has been touched by addiction. I was in the United States Army Infantry, and I did 2 combat tours, one in Afghanistan, one in Iraq. And when we came home from specifically the Iraq deployment, a lot of the individuals that I served with, this was at the time when doctors were overprescribing opioids, and I have lost a significant portion of the group of men and women that I served with. And, these were not individuals that, somebody would commonly associate with, and I hate this word, but junkie. These were American heroes, and I'm just grateful to the police department. They have given me every resource and opportunity to attack this epidemic any way that is reasonable, and I wish I could end it with the snap of a finger, but it's going to be a long grind, and I'm here for it.
Thank you.
Yes, thank you very much for your service then and now. And I know normally the second meeting of the month, we would hear from the Office of Homeless Services in general about other things, but we're wrapping up to the end of our time. And so we'll save their updates for the next meeting. So feel free, Director Calvin, if you can email us, that would be great. Any other remaining questions for the benefit of the committee? Seeing none, we're adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.